what I would like, to talk about my topic, but especially I would like kind of interactive talk. So I would like that you can also I would like you to ask me questions, okay? So first of all, I'm teaching cognitive neuroscience on the master program, and I'm performing research at the Department of Psychology. So I don't know if you know what does it mean, cognitive neuroscience. Actually, I'm studying high order brain functions by using brain stimulation technique, but also other techniques like electroencephalography, functional magnetic resonance, and so on. So, but my main technique is brain stimulation. There's nothing to be scared when we're talking about brain stimulation, okay? So my main topic is memory, so I'm studying memory functions, and motor control under different point of view. So under, how to say, more physiological point of view and under cognitive point of view. Like I'm studying motor imagery and action observation. I don't know if you never heard about mirror neuron system. I'm studying mirror neuron system too. So I will try to draft something, okay? So basically, what it might be interesting is that we can study brain function, as I already said, by, for example, functional magnetic resonance. Basically, subjects going to the scan, and usually a healthy subject, they are submitted to a specific task, behavioral task. It might be visual task, it might be attentional task, and we can observe which area are involved in a specific task. Let's say attention, we can measure attention, we can measure perception, we can measure memory, okay? But what is interesting is that we cannot causally address if a specific area is involved for a specific task. So because our brain, and how to say, classical theory thinks about a super brain specialization. So an area is important for that specific function. That's, for example, if we think about language, our left brain, our left hemisphere is much more involved in language. But if we have an important lesion on the left prefrontal cortex, we might be not able to speak so fluent. So we are losing our fluency, but that doesn't mean that we are losing all the brain processes. That means that all our brain is always interconnected. There are specific networks, okay? When I was working in London, I experienced the use of brain stimulation technique. Why it might be important and fancy technique? Because we can causally address the relationship between brain regions and their function. And we can do this causally, in a causal manner. For example, so I will try to design something. Let's hypothesize, how to say, this is our brain, okay? This is the posterior part and anterior part. And let's try to, so this is like a screen, and subject have to gaze to the screen. There are specific tasks to do, okay? What we do in our lab is that if we know that a specific brain region is involved, for example, in language or in memory, we can use a specific brain stimulation technique. This is a foil, and we can target a specific area, and we can also target other areas, for example. And what is interesting is that, okay, we can see in the scan that prefrontal lobe is important for memory process. Is that really true? And is true that left is more involved for verbal tasks and right hemisphere is more involved for spatial tasks, or for more how to say, visual orientation? And while subjects are submitted to a memory task, we target different brain regions. And only when we target, for example, the left prefrontal cortex by an interference protocol, our subject show how to say, drop down performance, so show less accuracy. They have less memory, okay? Look, we are not making our subject a real impairment, okay? It's just a temporal, it's called a virtual lesion. So we are stimulating some neurons which are functionally involved in memory processes. And this is so for me, it's really interesting, because if you stimulate, for example, the right prefrontal cortex, you can see the subject can perform the task like they were never receiving brain stimulation, like really like natural, okay? There's no drop of performance. There's no like decrease in performance. But when we target like a left prefrontal cortex, we have a decrease of performance, okay? So we causally address the role of a specific area. So I know that it looks like kind of technical stuff. I don't want to go so much deep in details in this sense. But it's really like really fancy technique. And what is interesting is also it can give you like time resolution. So what we can do with brain stimulation, we can use brain stimulation as an interference approach to causally address like specificity of different brain regions for different processes, like higher order processes, memory, attention, and so on. But we can also like use brain stimulation to increase performance. Actually, like when I was living in London, I met like a colleague and friends, and we can use like, there are two different types of brain stimulation technique, and there was like transcranial electrical stimulation, no magnetic stimulation. And usually scientists use this technique to increase or decrease performance. And then we were wondering why don't we go to use like alternating current stimulation to target our brain? Because our brain, it works based on oscillatory activity. So our brain, electricity in our brain, it works in oscillations, okay, by oscillations. And oscillatory activity is a sinusoidal activity. So we are now, and then we started some experiment, and somehow we were among the first ones doing this kind of new kind of stimulation. And we started to induce, instead of a magnetic fields on the brain, we were inducing like alternating current stimulation on the brain at different frequencies, okay? Actually, for example, we know that for visual attention, alpha rhythm, so alpha activity, so more high frequency activity is involved. You can record this with electroencephalography. But for example, for memory, we have a slower rhythmic activity, like in theta. And what is interesting is that by using this technique, we started to deliver on the scalp like different kind of electrical stimulation. And we found that, for example, in memory, if we deliver theta frequency, 5 Hertz, we can increase in normal subject, in healthy subject, memory performance, okay? If we deliver like gamma frequency on left prefrontal cortex, we recently demonstrated that we can increase fluid intelligence. So we make somehow our subjects smarter, okay? These effects are not permanent. They are just like short-term effect. So inside one day, the effect then decreased. But it's really interesting. And this is allow us to study the brain function. We can study the brain by inducing interference for specific. Can we fix this? Because okay, thank you. But we can also use brain stimulation to increase cortical activity and to increase performance. Look, it's not that we increase, for example, fluid intelligence, but don't think about that you're going to become a genius. So the increase is just like a small increase in healthy subjects, okay? Like subjects were more faster to respond, to answer like particular tasks, Raven matrices, intelligence tasks, okay? But this somehow gave us the opportunity to think to adopt this technique in patients that have lesions, patients that have a stroke, patients that have an impairment. Why this technique are important? What we can do with this technique? We can induce short-term plasticity. When there is a lesion, our like control-lesional hemisphere is going to compensate. There are some compensatory effects. Somehow the idea is that we can drive brain processes by external noise. It might be electrical, it might be magnetic. It's still a quartz technique, but it's really improved in the last 10 years. We can be much more focused by using transcranial magnetic stimulation. We have 1 centimeter square of resolution, okay? That's what we are doing, and we are doing it here in Moscow too. And we have a group. We have the motor memory motor control group. We study motor function by this. We are studying like memory by using this technique. And we have lots of opportunity. We have EEG, electroencephalography. We can also use functional magnetic resonance. That's very interesting. Okay, so that's what we are doing. And on the other hand, we can study like, this is just an example for more high order cognitive function. But we can also study like some important motor control processes. I don't know if you have ever listened about like mirror neuron system. Basically, it was, I mean, around 10 years ago, in Giacomo Rizzolatti's lab, it was discovered that if a monkey watch another monkey to grasp, to do this movement, this pinch to grip, pinching a nut, the monkey, the observer, which watching the monkey doing this, it's like neurons discharge as the monkey real doing the movement, like the monkey is real producing the movement. Okay, so if I'm doing like this movement continuously, your motor cortex start to discharge, start to activate. Okay, like you are really doing this movement. Usually, monkey is much more related to food. Humans is also goal directed, so it depends on your cognitive process. If there's like an object is an important object for you, it might be other cognitive process involved. But what is interesting is that this phenomenon is really automatic. As soon as I do like this movement, your brain, your motor cortex start to activate, like you are really producing that movement. And what we are doing in our lab, we are also studying this kind of phenomenon. And recently we showed that if we deliver, so in our subject, every time that we are doing this task, there is an increase of the motor function. Plus, if we deliver like specific alternating current stimulation, we can increase the phenomenon. We can boost cognitive processes. That's really incredible. Okay, that's what we are doing. Any question about this?
The previous lectures mentioned that regular implementation of this technique can cause to some effect. And my question is, to which kind of effect it could cause?
No, you mean which kind of?
Stimulation.
Okay, so that's a very important question. It's a question about safety.
No, not about safety. You mentioned that this brain stimulation can cause to an increase in some neural functions just once, and just have a small increase.
Yeah.
But as I've said, the previous lecturer said that regular use of this technique can be a reason of an effect. He has mentioned that this technique is used to cure depression.
Yeah.
And you can also use it in a limited quantity of cases, times. Yeah. Because in another way, it can cause to some other negative effects or other effects. I don't know. I'm not that kind of scientist. So my question is about what kind of effects can be caused by this technique when you use it periodically.
Okay, that's an important question. So your question is also a question about safety and is a question about like long-term effect. Okay, so when I was talking about short-term increase, I was talking about like normal subjects. So usually we use a healthy subject, no patients, for example, because when we are doing like basic research, we are usually we are using this technique to start to functional map the brain, to have a functional mapping. So you have to say you target an area, you see a decrease of performance. Okay, that area is involved in that kind of task. Okay, and this is the story. Then the point is that if we are using this technique to increase cortical excitability, to boost cognitive performance, the effect inside one day is staying inside one day. Usually, the after effect it might last 1 hour, no more. then what's happening is that neuroscientists thought about it. Okay, so we can use, this is it's called like a short-term plasticity, okay? Can we induce long-term potentiation, long-term plasticity? Yes, we can. But still is not like permanent. For example, in language impairment, like in aphasia, there were patients usually have one of the most common after stroke aphasia is the Broca aphasia, okay? So the left prefrontal area, called Broca's area, is involved in speech in language. People that have a lesion on the left prefrontal cortex, they go under brain stimulation. And usually, when you have a lesion, there is something that is called maladaptive plasticity. Your brain naturally starts to compensate the disease. And usually, it does this very bad. It doesn't do so good. So, meaning that you're going worse, okay? We can use brain stimulation to drive compensatory effect. And like in depression, language disease, in Parkinson's disease, movement disorder, we can use daily brain stimulation, daily session, okay? So you target the brain area continuously for let's say with TMS, even 10 minutes on the contralateral, the healthy hemisphere, and you induce right compensatory effect on the lesioned hemisphere. If you do this, for example, usually protocols are 5 days brain stimulation for 2 weeks, 5 days per week for 2 weeks. And it's been shown that if you do just 1 day, the effect is staying one day. But if you do for 2 weeks, for example, you may get long-term potentiation, long-lasting effect, even for 1 month. And then there are some studies that show that this permanent effect in a follow-up, they call back patients after 6 months, is still there. But after there's still the benefit of brain stimulation. But after 1 year, you start to decrease. So still, it's quite tricky. In terms of non-invasive brain stimulation, treatment on patients is still a little bit tricky. But it's true. You can, if you do daily session, you can try to do this first. Actually, in our lab in Siena, because before to come here, Moscow, I was working in Siena. I was working with my cognitive impairment, people that have memory disease. And we start to do this, daily session. But still, some patients it works, some patients no. So it's still course technique, course protocol. But you might induce long-term effect. Actually, what does it work with brain stimulation is if you link brain stimulation with some drugs, specific drugs, you can get long-term potentiation even longer. Okay? And what I mean is that it's really interesting technique. You can increase cognitive processes, but what really works is if you increase brain stimulation with training, if you make subject training, patients training, the increase is really big. Okay? That's what we can do.
How you use electricity to stimulate the brain? On a form of radio waves or as a current?
Yeah, we are using 2 different techniques. One is transcranial magnetic stimulation, one is transcranial electrical stimulation. With electrical stimulation is very light one. It's in terms of electrical current, and usually we deliver 1 milliampere, 2 milliampere on the scalp. Considering resistance from the skull, you get just a really small amount of electricity that reaches your cortical area. And we are inducing polarization of the brain. And this polarization may be polarity dependent. We can induce anodal electricity or cathodal. And the effect is polarity dependent. Anodal usually increase cortical excitability, cathodal decrease. Then we are using transcranial magnetic stimulation. The principle is a Faraday principle, meaning that there is a huge current that is delivered by this coil. This is a TMS coil. I'm sorry I cannot show you a real picture. And I'm a very bad painter. But what does it mean? Because of a Faraday principle, huge electrical fields generate a magnetic field. Magnetic pass non-invasively through the scalp. And it reaches another electrical field, which is the brain. And it transforms again magnetic into electricity. And in that case, just a single pulse of TMS can really trigger, can really induce action potentials at the neuronal level. So your neurons discharge, and your neurons produce an action potential. Okay, you induce like a quite big depolarization. That's how it works. It depends by the technique. We have transcranial magnetic stimulation and transcranial electrical stimulation. So actually, what is important is so now a lab, we're testing many subjects. There are also many students, many volunteers. And it's not, you don't have to scare about this. So it's not that like you are going to feel like it's painful or something like this. It's really non-invasively. Because of this, because for example, magnetic pass non-invasively through the scalp, you don't feel almost anything. And this is also important because we want to be, how to say, more ecological as possible. So while a subject is doing a task, we target specific brain area, and we are using also other control sites to control the effect. Okay? Then, for example, you have to think, this is non-invasive brain stimulation, it's what we are using. But in clinical application, they're also using invasive brain stimulation, like a DBS, deep brain stimulation, which also in US now, they're using that also for treatment of depression. And this is another story. You have 2 electrodes implanted into the thalamus, and for people that have Parkinson's disease, and you have to be eligible for this, actually, like they have like electrodes inside the thalamus, and they have like a kind of remote control under the skin, which is placed under the skin, and you can regulate like a frequency of stimulation, and the effect is really huge. So the patient really, so any tremor come down completely. But you have to be also eligible for this kind of treatment. But we are not doing this. We are not putting like electrodes inside your thalamus. Okay, that's very important. Just to let you understand.
Yeah, so you said that coupled with training, the brain stimulation can be especially effective. And my question is, what kind of training exactly achieves that effect? And also, what is your opinion on the very popular brain training games and iPhone apps and everything?
Yeah. That's very interesting. That's a very nice question. So, actually, well, there was kind of limitation, I mean, since like a few years ago. So, because we, as a brain stimulation people, we used to check like the way, like to increase cortical excitability, to increase performance, because of what? It was just like a nice purpose, because it was just like for clinical application. So if we increase, first we test on a healthy subject. If in a healthy subject it works, let's go on patients. And that's a very nice point. But another nice point is that clinical doctor, medical doctor, they observe, they were like there observing from the top of the hill and say, okay guys, you're increasing performance. But you see our patient, we just training. For example, who is using like, for example, for aphasia patients, they have like language impairment. If they do daily training, they recover faster. You can use as much as you want brain stimulation, but with training, they do better, okay? But recently, it's been shown that in the last 2 years, that if you couple brain stimulation, okay, let's say another TDCS, transcranial direct current stimulation, with training, you increase better than only for training. How it was done? How they do this? So, for example, there are colleagues from UCL, for numerical processing, they show that delivering electrical currents while they were performing a numerical task, subjects on the specific target area, on the prefrontal cortex, subjects, they were increased performance, really like they were a huge increase respect to another pool of subjects, they were just doing the same training with no stimulation. And another pool of subjects, just stimulation and no training. So if you couple together, you get this increase. Now the point is this, is that, I'm sorry I cannot show you by picture, but now there is like a super trend. So the question is that transcranial magnetic stimulation is a huge device. And just a few years ago, when I was like Googling, I found that there is a company which is selling transcranial electrical stimulation, which instead is just a small device like this, and as a toy. for improved gaming, okay? And I showed this to the head of department, to my chief, and we were like impressed. So you can do transcranial electrical stimulation. You can buy the device. It's $250. It's called Focus, okay? And we were like shocked by this because in any case, it's not like so much safe. If you do it in the lab, you know that you can, your brain stimulation can be like submitted your brain can be submitted to stimulation for 10 minutes, 15 minutes, no? But they were promoting, advertising this technique. Like if you are at home and you're playing like PlayStation and you put this, you can improve your performance. And actually this device, it delivers really like 2 milliamp currents on the brain. And you can stay all day long like with your brain stimulated by this device. And we were so shocked that we wrote down an editorial to an international journal, which is brain stimulation, against this. It's a question of ethical issue and safety. Yeah. But there's still, actually when we were checking on the website, there was no like, there was just developed by some engineers. There were no any medical doctor advertising, any neuroscientist advertising, anyone. So we were quite impressed. So don't buy it, okay? Come in the lab. Okay, come at the department. We are in textile shipping. You get the purple line, you come and you experience brain stimulation. Okay, don't buy the stuff from home. It's not like safe. And then, actually, if you buy, you don't know which area you have to target. Maybe you're going to stimulate the auditory cortex or visual cortex is not involved like in your, how to say, Tomb Raider. Okay.
And what about medicines which stimulate brains? Are they safety or not?
Okay. So yes, some drugs like are, of course, if there's any kind of medicine is going to be like tested and approved ethically. Okay. But what is interesting with brain stimulation is there are, for example, with psychiatric patients, they are drug resistance. Some of them. So meaning that drug treatment doesn't work. And it's been shown recently that for those kind of patients, brain stimulation might be like an alternative way to treat. But yes, so usually drug, we suppose, I trust that this, unless you get something from the street, I suppose that these are safe, okay? But the importance of brain stimulation is that the usage of brain stimulation might be also for people that are drug resistant. There are lots of studies for this, especially in psychiatry disturbances. When I started, I said, let's hope the weather will stay on. It seems to doesn't work. So that's what we are doing, okay?
I want to ask, well, you said that with brain stimulation where our brain will work more better, and also it helps with psychiatric patients and everybody who have a brain malfunction.
Yeah.
Through this brain stimulation, can we cure any physical malfunctions or something like that? Do they help when I know a person can't move his limb or something like that?
Yeah, I see. So there are some studies of motor disturbances, like for essential tremor or dystonia, when patients cannot grasp so good because they have like a lesion or a stroke, and then they have like hemiparesis. So for example, they can move their hand, but they cannot move any finger. And it seems that works, because for example, we can do like a functional mapping and stimulating, like there is one of my collaborators in the group, Maria Nazarova, she's working on this. She's working on patients. She's working on patients. She's a medical doctor. She's a very smart one. And we are she's working on motor cortex mapping, okay? So we can do an intervention with brain stimulation. But still, we are at the beginning of the story. For example, with alternating current stimulation, so stimulation, as I told you, like electricity delivered a sinusoidal one, is being shown by a London group that for people that has essential tremor, that kind of stimulation, specific frequency, it reduced the tremor drastically. it doesn't cancel the tremor, but just reduce the tremor. The idea, guys, I think the talk is almost finished. But if you resist 1 second, I can tell you this, okay? I can try to drive something, okay? Okay, I can. Okay, just another issue with brain stimulation. So the new advanced one that we are studying now is alternating current stimulation. So, for example, when you're sleeping, your brain oscillates slowly. It's called like slow wave during sleep. Okay, when you're awake, your brain oscillates more frequently. Okay, you have high frequency oscillation. Some area oscillate specific rhythm, like in theta, some area in gamma. For example, in the intelligence task, we were stimulating gamma. For the memory one, we were stimulating in theta, different regions. The idea is that if you deliver this kind of sinusoidal external activity, you can anchor your brain activity and go in phase, locked to the, in stimulating phase locking, phase locked to your oscillatory activity. Your brain starts at a certain point to oscillate at the external one. So if you have like theta 6.5 hertz and you deliver 6 hertz, your brain starts to oscillate at 6 hertz. This has been shown recently. Okay?